Hi Andrew, thanks for asking why I think the NHS is corrupt. I came to the UK in 2004 as a consultant anaesthetist. I was following the father of my children who had previously served the army and was homesick, and I just had my children, the break of career. And when I came to the hospital in my jeans trousers, the local consultant examined me from top to bottom, looking while I was there with jeans trousers, and he's sitting there in his suit. And he said, "So you're a consultant?" I said, "Yes." And he said, "What have you done so far?" I said, "Well, I did everything except an epidural for a pregnant one." "You can't be a consultant if you haven't done an epidural. I had to do myself. 650, you're not a consultant." And I said, "Well, have you ever transplanted a heart?" And he said, "No." I said, "And I'm not saying you're not a consultant. Please respect that. I come from a different system with a different education, but I am a consultant." Anyway, I rang up the GMC, and because they just offered me a staff grade post, I rang the GMC and asked them for support, and they offered me a return to work scheme. During the return to work scheme, which lasted 8 months, funded by the NHS, I figured out that they haven't had the intention to bring me up to a consultant level. They didn't let me do ICU work, which was required for the post, and they didn't let me do epidurals for pregnant women. Secretly, I was taken by foreigners to the side who said, "Just do that. It's nothing special. You have done epidurals for thoracic surgery. Epidurals for pregnant is nothing different." So I tried, and I realized there's really no difference between it. And in addition, a consultant from New Zealand said to me, "Don't you see the game, how it is? They are buying cheap laborers from foreign countries to keep their bum in the seats and not doing anything." So after my time, I asked them for my consultant post, and they said, "Unfortunately, we have only a staff grade post for you available." I said, "But we can give you your references if you want." I said, "Yeah, please give me the references. I'm not working as a staff grade." I applied in 3 places. The first one, and all 3 replied, "Yes, we want a consultant. We are needy of consultants." The first one then said, "I'm sorry, we already found a better candidate than yours." The second hospital replied, "Haven't you got any other referees than the one you've got there? Any different places you have been working?" And I couldn't offer that. And the third place said, "Listen, they keep ringing here. We are just an agency, and they keep ringing here. They say, don't give her more than a staff grade post. She's not ready for that." Is that open and honest? I'm just asking you out of courtesy. So I say to the agency, "Please then give me this locum staff grade post. I'd rather be a locum staff grade than working for them." I approached the the anesthetic director of this department and said, "Please, could you give me a reference at the end of my time to be a consultant, or a list what I need to do to become a consultant?" After 1 month, this hospital, which let me do only ICU and obstetrics, which was actually required to become a consultant, offered me a locum post and the reference to become a consultant. But the contract was quite lucrative, and I decided to do the locum, to continue my locum work. After 1 year, I saw an advertisement for 3 consultant posts very close to my home, and I decided to apply there. And because I was used still to the German system, where you introduce yourself, you work for a little while, and they look how you can work, because obviously paper is not that important in Germany. It's more how you are fitting in the team and about your skills. So I offered them to work as a locum staff grade for 3 months, and said, and if the advertisement for the consultant is, I'd like to apply. And as you know, as an anaesthetist, you don't work with other anesthetists together. So I worked with the surgeons, and suddenly one of the doctors kindly told me, "There is a bird singing from Doncaster who said you can't do obstetrics and you can't do ICU, and that we shall not give you the post. And I bet you will not be invited for a consultant interview. And then I spoke to all the other consultants, surgeons, and they made a big list writing to the medical director that they haven't worked with an efficient and good working doctor like me, and that they would prefer me to have as a consultant anesthetist. But obviously it is always laying in the anesthetic department, and I was never shortlisted in spite having this list from the surgeons sent to the medical director. And the nurses which were working there said, down the road there is a little private hospital and they are not really interested. They do beauty surgery and they are not really interested in politics, and they're just interested if you can do the work. So go to this guy, he's very nice and very kind. You will be getting a job there. So I walked there, applied for the job, got it. And this man has been as well having a campaign to chase up NHS delays. And in this campaign have been working medical directors from universities all over the country, very, very skilled surgeons. And obviously as anesthetist, I don't work with other anesthetists, I only see the surgeons. And when I observed them, I felt that they are the best doctors I have been working ever with. One of them even had a heart attack during surgery and said, no, I finished this one. And then after the list, he said, oh, my heart is aching, I just need to go to the doctors. And he had a heart attack during surgery, still finishing, looking after patients and working for them. And with the NHS delay work, we chased up 6 years waiting time down to 0 within a year, which was obviously a thorn in the eye for the private practice for the locum consultants. And medical staff, nurses which worked for the university or hospital consultants there, and for us with the NHS delay, twittered in my ear and said, they are collecting against you, just be careful, just be careful. So I approached the initiator of the NHS delay campaign and said, listen, they are trying to collect against us. And he said, don't you worry, these are the best doctors, and if you see percentage-wise, the outcome of our patients is better. We have far less complications than them. On the day, the medical director of the university who has been supporting our campaign retired, and the new director was employed. The local consultants presented all complaints and not accurate surgeries, because obviously wherever you work, you will have some complications. The new medical director has never seen so many complaints, because obviously he has never seen someone working so hard as we did, right? But because he saw that, he got basically talked into writing to each of the patients who has been operated by the NHS delay campaign, and then patients were offered free legal advice, asking, did you feel there was something wrong with you? We are offering free compensation and free legal advice. The very next day, each consultant working for this NHS delay campaign had such a pile of complaints that basically all of them were standing in front of the GMC. The only one who wasn't standing there was me, and they advised me just go and work somewhere quietly and try to get private practice on the other side so that you are not getting the complaints, which I did. I applied in a university near my home as a locum, working there, got straight away in the private practice, and it was very good for me because I earned quite a good amount of money. And the doctors, because obviously when you work a lot, you're liked much, they gave me a lot of private work. I figured out that there was someone jealous towards me, And the one who was jealous towards me, I don't know who it was, complained to the private hospital, says she's not holding a substantive post, don't give your private work. So I lost my private work. And the anesthetics I have been providing, you need to count for them privately, were not paid on the ground that I didn't have the permanent consultant post. And I'm just wondering where the money has gone to. Obviously. That's the game, how it works. And I continued working for the guy who had the NHS delay campaign finished. He still worked in his private practice, so I supported him. But because he was struggling financially extremely through the way that he was bankrupt, the manager who was working for him took advantage. He stole basically half of his staff, patient notes, and opened his own business. And when the owner of the private hospital found out, which I was working for, he asked legally for his patients back. And in that moment, the one who stole the patients complained against him and me to the GMC, because obviously that was my partner at that time. We had a liaison. The GMC didn't find any guilt in me, to be fair, but I was exposed to the solicitors of the MPS, and the whole thing were dragging on for 4 years. And while it was dragging on for the 4 years, I said, I can't stand it anymore. And I can't stand this insecurity anymore. And I was working halfway backward, forward in Germany, in the UK, because I was frightened to lose my job, because I had seen before that every consultant who has been working was then begging for work and not finding anything. And these were NHS doctors. So I was really, really scared and didn't say anything. And I had fear, and I said to them, just say I'm guilty. They said, no, you can't do that, they will strike you off the register. And then I said, well, then say no. And they said, yeah, but if you do that, we are actually trained to twist the word in the mouth. Don't you understand that system? It's not about right and getting right, it's about winning the case. So obviously, I was stuck there for 4 years under this pressure, and my partner was under this pressure, and he couldn't trust anyone anymore, anything. And under this pressure, he basically finished with me. And then I didn't want to work for him in the private practice anymore, and I took up an NHS post. And while I was working for the NHS, I regained all the skills to get back to work. But unfortunately, my partner who had finished with me, and I was hoping he would find me back, had another relationship, which was basically for me a no-go. And I was really shattered because all my life was breaking together. So I went back to Germany to get a little bit of support from my family. And after recovering, I wanted to work in the NHS in the UK again. And that was almost impossible because of the paperwork. Managers wanted me to work, the department wanted me to work, but I couldn't fulfill, basically because of the difference between Germany and the UK, all the appraisal things and stuff. And it was dragging on, that I didn't get the jobs. And now in February, I applied again for a job, passed the interview, and medical staffing said, well, we need your CRB and your HIV check. I said, well, CRB, I'm not really living with this guy anymore. They said, but we still need it. Otherwise, you can't work. Okay, I tried to provide that. And we need actually a German certificate. And I tried to say, you know what? How important are the documents? My HIV test, which I had from Germany, was not valid because it was not made in the UK. The one which was made in the UK was lost. So it was delay again. And I said, listen, how important are the documents for you? You know, when you have your employees, they can invalidate any of the documents within a night. And now you are training nurses to become a doctor who hasn't had the training as me. And they said, sorry, that's the system. And I didn't get to work. And with Corona, I had time to think about it. And whilst I've been working in the UK, and now it comes really, I need to tell you about being scared, arrogant, and ignorant. These are things which happened to me. When I worked in the NHS, I came across to a baby which had to be resuscitated. The midwife was standing there and said to me, have you got your APLS course? You can't touch the baby if you haven't got it. I said, I don't have it, but I'm in Germany and trained in Germany. I'm doing that with the children. And she says, no, I can't do that. The baby wasn't breathing for 8 minutes because she couldn't ventilate it. She had the course, yes, on a dummy, but she was not ventilating the baby. And I said, stop, please, please. And she says, no. I said, then hold it. And I put a little bit of high pressure on because that is a treatment you can do to open the ductus there. And she was scared. You're doing the pneumothorax. She didn't even recognize that the baby wasn't ventilated. And she was screaming and shouting that very loudly in theaters. The lady which had an epidural was listening to it, and it was totally embarrassing to me. Then there came the next lady with urgent section. And I wanted to go because I had a registrar with me to go to the next theater because that's as normal. Epidural is working, just closing up. They said to me, no, you can't do that. You can't go there. You need to stay with the patient. You have responsibilities for the patient. I said, okay, I stay here. And I waited patiently for basically sewing up, and nothing really happens then. Patient finished. I wanted to run for the next lady, which had bad heartbeats. And she said, no, you can't go there. You need to wait until the dressing is there, until the patient is in recovery, and you need to make a proper handover. And I felt always like, this is not really right. Because obviously, if you are in an emergency, you need to prioritize, and you must make common sense decision and not just by the paperwork. And when I tell you, we are treating numbers, you have all the young doctors which are making the P-possums and whatever, looking at numbers, but they are not seeing the patient. And I'm asking you honestly, who's a better doctor? Who says, I don't mind if my score is not really, the survival rate is not good, but I'm giving this patient a chance, or not? I was an A&E for a lady who was obese. She has had no treatment before, and I know when I went to the GP, I wanted to see a GP. They said, this week it's very bad. You can either have a student or a nurse. And I said, well, then I take a nurse. I know that how the system is, and that is not right. So there was a lady coming in with no medication in A&E, and she was decompensating with her heart. And because I am trained in different ways, I know you can try some treatments with beta blockers, freezes, and recompensate the heart, especially if they haven't had no treatment before, put an outline in and everything. The consultant came, what are you doing there? We are not a cardiac unit. We are not doing that. And this lady is, her problem, if she's so big, she pulled everything out and let this patient, if she is doing that, then she needs to die. And she said that in front of the patient. And I just felt like, how can you do that in front of the patient? In addition, there were 19 hours in A&E waiting time, in a queue. Theaters was ready. Patient had his x-ray, all the labs done. And I was waiting. I said, why don't we take this patient into theaters? We are all waiting here. And you know what they said? No, we can't do that because of inspections. the hospital will be shut down if we operate on trolleys. We don't have a bed. We need to meet all criteria. Do you know what? If someone is waiting 19 hours there in front of the hospital to be seen by a doctor, I'd rather be operated on a trolley and make these common sense decisions. But we can't make these common sense decisions anymore. And I'm really fed up of the manager managing what the manager can manage and tell me as a consultant what I have to do and binding my hands. This is really just not up to date. And I tell you another little, I can tell you many stories which I've seen. I was called out of theaters for resuscitation of a lady who has been postponed 3 times before surgery. While I was running to the ward, a nurse called me back. I'm the infection nurse. You're running around with your face mask. Take it off. I took it off. I'm for resuscitation. Come back. Disinfect your hand. That's more important. So I disinfect. Running to the resuscitation because obviously every minute counts. You know that. Then I resuscitated the lady and I found out that she hasn't had a doctor who could prescribe some fluids. And she has been basically starving. She hasn't had her medications. And I just felt like, this is really the NHS? You know? I just think the common sense is missing. And you can make traffic lights in every corner to make it safe. But when the money for the car is missing, it's just missing. And I feel like the common sense is missing. So from my point of view, it is really needed to sort out who is corrupt and who isn't corrupt, who is just getting the job and is actually not capable of doing the job, and understanding what's going on. And we need more workers for the patients, interest with the patients. So now you understand why I think the NHS is corrupt. Because obviously, if you are getting a job and you're not competent for the job and you don't know and you're not capable and able to make common sense decision, you are not suitable for the job. And now I'm running out of my GMC paperwork and I will be probably struck off from the register because obviously with the corona shut down 14 days, why should I do that? I have enough work here in Germany. But I wished I could have help because for me the world has no borders and I feel really sorry for the NHS payer which are actually deserving free healthcare but in an efficient, common sense manner. And many things are just done for the sake of paper, to defend yourself. But when the law system is like this, it's a circuit. Yeah. And then think about money. You can either serve the money or you can serve something good.